My patient this week is a 14-year-old female, with African-American female with initials TB. She has TRICARE Prime and is single. Her date of birth is 02/07/2006. She was accompanied by her mother and is a reliable historian and answer all questions appropriately with a clear, concise voice. Her chief complaint has been coughing, sore throat, and ear pain for about a week now. She's premenstrual female. She reports it is getting worse and it is occasionally hard to swallow. Reports all symptoms occurred about a week ago. Reports non-productive cough has increased in frequency. Denies being worse at night. Precipitating factors include eating, talking a lot, and swallowing. Coughing episodes resolve with the usage of Cepacol throat spray. Patient reports no other alleviating factors. Reports slight decrease in appetite due to the hurting of her throat. Denies any similar episodes in the past. Denies any drainage from nose, ears, and eyes. Denies any heartburn, belching, shortness of breath, wheezing, or chest tightness. Denies being around anyone that has been sick. Denies headache, fatigue, fever, or malaise. Denies having any oral sex or being sexually active. Denies any history of asthma, chronic allergies, or any respiratory diseases. Patient is up to date on her immunizations, and patient received her influenza vaccine. She had a complete physical earlier this year, an eye exam, and she sees the dentist every 6 months. She does not have any chronic medical conditions. She denies the usage of illicit drugs, tobacco, and alcohol. Her surgical history includes a appendectomy at the age of 5 and admits being up to date with her childhood vaccine. She has no drug, food, or seasonal allergies or environmental allergies. She takes no medications. Father has hypertension and hyperlipidemia, and mother has hypothyroidism. She lives in a townhouse in military base housing on board Fort Story with both her parents. She has no siblings or pets. She is in 8th grade but attending virtually. Her dad is in the military and gone frequently. Reports stressors of going to school virtually, not being able to see her friends, and not being able to participate in sports. Reports would like to be in a relationship, but she is not currently. She denies ever having been active sexually. She attends Ebenezer Baptist Church prior to COVID. She reports her parents, friends, grandparents, aunts, and uncles are her main support system. She denies difficulty sleeping and reports waking up well rested and refreshed. Reports she enjoys playing in the backyard in her tree house, but denies any other physical activity. Her diet is eating baked or grilled meats, steamed bagged vegetables, ramen noodles, and an occasional sweet apple turnover from McDonald's. Reports eating McDonald's once a week for dinner. Endorses the use of seatbelts when in a moving vehicle. Endorses the use of sunscreen outdoors. Denies depression, anxiety, and suicidal thoughts. This patient presented a little different. Once I did the physical exam, I initially thought it could potentially be COVID, could be pharyngitis, could be a peritonsillar abscess, could be mono, especially because of her age. And what it appeared to be is, upon examination, tonsillitis, which basically is gallstones. So when she opened her mouth, I saw her tonsils, and they had stones on them. So her diagnosis was tonsil stones. And that was what made it quite unusual. And as soon as you examined it, we were able to pinpoint the exact cause of all this. So treatment would be gargling with salt water 3 times daily, brush her teeth at least twice a day, and she can gargle with either salt water or an antiseptic to make sure that she drinks water after eating to flush away any of the remaining food that is in the back of her throat. And we put a referral into ENT since it is bothersome to her. So that made quite an interesting case to me. It was something that I had never seen before, and obviously it made it interesting because it was not familiar to me. Thank you, and I hope you guys have a great night.